Hi, everybody. So I am Christopher Archiopoli. My pronouns are he, him, is. And this is King County Recovery Conversations, but special edition addendum. First time that we've done this, but I think that what I'm really excited about is this is a great representation of kind of how we tell our stories sometimes. I'm here with Tasia Baldwin. We recorded her episode about a month and a half ago, and a week or two ago, she sent me a text and was like, "Hey, can I talk to you?" And I was like, "Oh, I wonder what this is going to be about." And I was in a hotel in Baltimore for a healthcare conference, healthcare for the homeless, and laying in bed talking to Tasia, and she was telling me, like, when we did our sit down, I told a story that I feel like requires additional context. At the time, I wasn't comfortable, and sharing all of it, and with some additional reflection, I feel like I want to add to the story. And at first I was like, how do we do that? But I realized as I was sitting there, like, this is how life works. And I think this is really a beautiful opportunity, because especially when we're talking about like vulnerable stories, when we're sharing information that maybe isn't the most comfortable thing to share, like in our day-to-day with work, and even with most of our personal relationships, right. It's this very superficial, let's not go too deep, let's not make anyone too uncomfortable. And so the natural response often is, I don't want to rock the boat. And
yet we're here.
Well, and that's why I loved being here. I was like, well, we've got to make this happen. We've got to figure out a way for Tasia to tell her story. And so I'm excited for you to add to the story that you told, and to give it some more depth and some more texture. So that is my introduction. I'm so happy to be here with you again, and feel free to correct anything I just said also, but I feel like that's my side of it.
I think everything you shared was perfect. As you summarized, I reached out to you a couple of weeks ago, but we interviewed, quite a few weeks ago, and then something had just been on my mind that I hadn't really shared my full story. And part of it was because it wasn't just my story. It wasn't something that I was wrestling with by myself. And that story is one of tremendous trauma that my family experienced through sexual and physical violence, as well as mental health, and that mental health going through recovery and relapse, and not being diagnosed, some of my siblings not being diagnosed, but my mother's being diagnosed with different conditions, and wanting to protect us, and trying to balance what I feel like I was taught as I was growing up, in addition to just social norms. You say, how's the weather? And somebody asks you how you are, you don't necessarily say like, oh, I just had the worst day, right?
Right.
And so that's just been so instilled in me, of this like duality of visibility and invisibility. I can be visible and say, hey, I had a hard day, but I couldn't say, it was because I don't know where my mom is, because she made sure that she was seeking help and I just didn't know where she was. Or this family member is self-medicating in the household, and gosh, she's usually this really chipper person that's super easy to be around, and now I feel like I'm being manipulated and told what to do, and I'm supposed to be cared for. I'm the youngest of 5 kids, and my 2 moms that raised me, and so I learned how to navigate a lot of that and normalize a lot of that experience. And so when I think to the interview that I shared with you, I did a lot of what I did, what I'm doing. Maybe I shared some knowledge I had about HIV, because there was an individual within my family unit that died of HIV/AIDS, and we just didn't talk about them. There was a complete erasure of mourning for their loss, and for their experience, and everyone who's been impacted by the fact that that person was a person of value. But then also the research aspect of like this curiosity and this wanting to figure out how do these pieces come together so that we can make sure that someone has access to a better health outcome because we've considered them. And then how does that work within the family unit? I was so easy to tell that part, because it's just like this professional veneer that you kind of like slacker on time after time after time, because this is how you're kind of trained to be a successful person in society. But then there's this other story behind that. And what I really want to thank you for of creating this space is after I had my interview with you, I just felt not great about myself. I felt like I wasn't being authentic and putting a name to the shared experience that I had with my family and the shaped experience that was created for me. And I went and I first started with my mom, who I'm closest to because I've been her caregiver, and so many other things for her. I call her sometimes my child, which is, I know there's sometimes an evolution, but that started really early on in my life. And I said, you've been through a lot. You've been through a lot before I ever existed. How would you feel if I shared aspects of your story? And, she consented, and I said, okay, now what does it look like to talk to some of my other siblings about this and where they're at? Because there was, some things that have happened recently with them. And I said, I think I may not have to share every story or the specifics, but just sometimes putting a name that something happened and it shaped you. It impacted you positively or negatively. And for me, not sharing it was like, I'm protecting myself and I'm protecting everybody else. I don't want you to have a thought about them that I've allowed you to do because I opened up, right? But in talking to them, they said, no, share my story, and whatever someone else can glean from that, like let them glean whatever they can. And so after talking with them, it ended up being almost like a healing and restorative cycle of experience for me of how much I can kind of hide behind the veneer of having been privileged enough to go to school, having been privileged enough to leave the community areas where I'm at, where I still have friends who are alive or no longer alive from things like gun violence or other considerations like that. So coming here made me kind of look at myself, and I just thank you because it also opened up conversations now with my family where I've set boundaries where I haven't always necessarily been in the best communication with them. And so I'm actively going through my own cycle of just healing and restoration and recovery. So I just wanted to share that for anyone else who's a part of someone else's story and may not feel like it's theirs alone to tell because they're a loved one, they're a caregiver, they're that child. Or something's been put on them that they have to deal with. This story is to just share with them that they're not alone.
Yeah, the recovery is very rarely neat and tidy. It's messy, but the messiness is beautiful, and that's where the best stories lie. Is there anything that you wanted to share in addition to that?
I think that we captured it.
Great.
As I continue to go through the mess, I hope to kind of just peel back that onion and bloom and figure out what other things that I experienced, especially that I'm open to sharing when that time is right.
Yeah, I think that's really beautiful, and I'm grateful for you to be willing to be vulnerable and to open that door because you're sharing and you're healing, not just for yourself, but for everyone that watches and listens to this, and making it okay to not be okay, and to acknowledge.
It is okay to not be okay. It is okay.
Absolutely. Yeah. And yeah, so it's okay to not be okay. And it's okay if to correct things and to be wrong and to add details and, keep growing.
Yeah, and to ask for another chance to say, can I say more? Can I do more? I think that's a part of being real and authentic to ourselves. And you'll find people who give you space to do that.
Yeah, that's well, and thank you for trusting me and for trusting this King County Recovery Conversations and everyone that is involved around it, because it is bigger than just me too. I mean, you and I have had a relationship for the past couple years, and so we've built that trust. But this is something that you're sharing with a larger audience, and there's a lot of trust that went into that thought. So thank you.
Thank you.
So, well, Tasia, thank you so much. I'm glad to have you a second time, and I'll take you as many times as I can get you. And I'll congratulate you one more time on getting into med school. I think the where has officially solidified since we last talked, hasn't it? So
yes.
Do you want to share as a closer of like where you're going to be going to med school?
The University of Washington, so I'm not going too far.
Yeah.
And my work and myself and my presence and everyone who has helped me and who I can help, I'll still be around here to continue to build those connections and relationships. So I'm really grateful and really excited, especially during this time.
We are grateful to have you in our community.
Thank you.
So, thank you, Tasia. Thank you, people that are watching and listening to King County Recovery Conversations. And thanks, Nate at Orbit Audio, for being amazing every single time. Take care. All right. Hi, everybody. Welcome to King County Recovery Conversations. I'm Christopher Archiopoli. My pronouns are he, him, his. I want to thank the King County Recovery Coalition, King County Behavioral Health and Recovery Division, and Orbit Audio for hosting us today. My guest on this episode is Tasia Baldwin. I've had great opportunity of collaborating with her on multiple things over the last several years. It seems like every time I show up to an event, she's there doing something. She's either emceeing or hosting or organizing. So she's just kind of a powerhouse. And I know she's got an inspiring story to tell. And I wanted to connect you all with an amazing person. So Tasia, I would love for you to share in your own words your story. Like, who are you as a person? I know that you are involved in research in some capacity. You're going to med school. Like, I could talk and sing all your praises, but I would rather you put it into your own words.
Well, first of all, thank you for having me. Thank you, King County Recovery Coalition, for having me, and sponsors as well that you've mentioned. So as I share my story, you shared about medical school for me. So as I got from that point that I'm at now, matriculating this June, it really started as someone who grew up in the south of I-5 corridor way in Pierce County on the Hilltop area in Tacoma. My parents saw their opportunity to really escape some of the social challenges that they were experiencing. And that was really, they didn't have a lot of financial stability. And so they joined the military and ended up being stationed at Fort Lewis McChord Base. My parents separated when I was 2, and my mom ended up at that time also becoming ill, but also wanting to live her own life. And I'll talk a little bit more about that. But in that process, my brother and I, my brother got to see my mom healthy, and that was not something, fortunately, I got to see. So I spent a lot of time with my mom at the Veteran Affairs Hospital, at the hospital down the street, at the clinic, wherever kind of she needed time as I was growing up. And she left a really hard life with my dad, but also she found her truth. So since I was 2, I grew up in a mixed home as well with a bonus mom. So I grew up with 2 moms who raised me and my brother and 3 other siblings. And I got to see love through that lens on the Hilltop area. But I also got to experience the social challenges of same-sex parents raising kids. And if you don't know much about the Hilltop area at the time, it's changed quite a bit. But, just getting basic access to education, to food resources, to transportation, it was pretty difficult. And so little Tasia, the youngest of 5 kids in the household, I just got really passionate about doing something about it. I was such a curious kid. And one of the ways I wanted to do something about it was to help my mom specifically. So, going through that process, I always just thought, oh, the doctors are the ones that help. And so I saw myself wanting to become a doctor, almost in defiance of really not seeing her recover fast enough, not seeing her live her best life fast enough. And so kind of fast forward through that kind of seed that got planted in me, I've done a lot of community work, as you've discussed, as you've shared, but I have been involved with the Center for Disease Control related to capacity building to support the same communities that I've described. I've been doing work for large hospital systems to look at cost and quality so that we can bring access to communities that are experiencing some of the challenges that I described. And then in a really interesting way, how I got into research as this conversation is moving towards. I had a woman named Ro Yoon come to my school in undergrad as I was saying, I'm going to be this doctor. I'm going to do this thing. And she shared with me that there was an epidemic that I didn't know anything about, and that was HIV. And, having that eye-opening moment of thinking that was something in another country, somewhere else, it wasn't in my own backyard, it really led me to want to get involved because I didn't understand why it was impacting the communities that I cared about. So that's kind of how I got involved in research.
Yeah, there's a couple questions that I have from that. Probably 100 questions that I have from that, but a couple things I want to dig into a little bit more. So, to extend from that, can you tell people what the vaccine trial unit is, the VTU? Because HIV research, but what is that? What does that mean? Like, what do you all do there? Because you're on their community advisory board, right?
Yes. So digging a little bit more into who the HIV trials vaccine unit is, they work with the HIV Trials Network, which is an international global research body that is right down the street from us at the Fred Hutch Cancer Center. And they focus on ways to prevent HIV. They've done a lot of work to focus on how to cure HIV and how to treat HIV. They've also done monumental work with the COVID-19 response and supporting the vaccines that were created for that, but then also other treatable diseases like tuberculosis. And so in the mix of researchers doing all that work and scientists doing all that work, there's a community advisory board with the Vaccine Trials Unit, which is a supporting body of this larger institution, so to speak. And they have a community that has a say, a view into research that can be really inaccessible. And so my participation in that work is to call out when something doesn't look right, to ask questions about research that we don't understand. Because oftentimes, if I don't understand it and I want to know about research, then the community that's supposed to help supposed to support is likely not going to understand either. And I just want to share, I didn't join the CAB because I was genuinely curious, and being a doctor, I had seen that as something so separate, like this thing about becoming a doctor and this thing about getting into research. I had kind of put them in two separate boxes because growing up, I was told of stories about, how the whole guinea pig idea, right? Like I was told, like, if you are a person of color, if you are someone who's seen at the margins of society, then you're just going to be used essentially to advance someone else's agenda. It's not going to support you. And so when Rose shared with me that there was this epidemic and that there's this research going on, and there's not a lot of representation from communities of racial and ethnic diversity, of gender diversity, including women, and women across the identity. I want to include transgender women as well in research. It really highlighted for me, like, oh, I wonder why that is. But also, it opened up for me, oh, this is the opportunity to explore like some skepticism I have, some safety issues I have. And if I want to be a physician, I'm learning that what comes out of research, that work isn't just over here. Like, it's actually connected in the way that we see our everyday health and the medications that we're given if we're a patient that receives care from our provider. And so I wanted to really understand what was going on kind of in this black box that was making me feel uncomfortable, because we have seen the historical trauma of experimentation on so many individuals that have found themselves at the margins.
Yeah, I mean, that's absolutely true. And, what I appreciate about what I've learned about research is that, there are these efforts by scientists, by researchers to include community in these processes. I'm not part of the VTU CAB, but I am part of the Community Advisory Board for UW Positive Research, and I know that we collaborate a lot. That's my shirt today, taking pride in research. So, I mean, I think that's something that, I am grateful for, seeing that. Now, why is research important to just sort of like the everyday person? Because I think that, we were talking about this before we started, a lot of times people see academics and researchers and scientists in this sort of like ivory tower, looking down upon us all, we're all smarter than you. But the more people that I get to know, the more I realize that's not true. And the more I recognize that so much of research is intentionally designed for the needs of, marginalized communities and people like you and I who, have been, disproportionately impacted by bad policy, and racism and transphobia and homophobia and all the phobias. So the short version of that question is, why is this important to just a regular person?
Yeah. I realized that more than just coming up with something that is innovative, that is supposed to bring health to someone, it's important because it builds bridges, and to the point of the name of this podcast, it gives opportunity for folks to recover. And I say that because with research, it's not just about finding that intervention that might be a medication that you take. It might be a tool. It might be the glasses that you have on your face. Like, that's a prescription as well. It's important because it highlights a better understanding of how our bodies work, how we interact with other folks. And so to the everyday person, I think that research matters because it's not just like the bench work that you see. I'm working through it.
Yeah, no, it's
not just like it's not just the bench work that you see. What you also have a better understanding of is the health and solutions that it brings to people. So like one of the things that I think about is the fact that when we look at going like way back before my time in the 1980s, right? As interventions started to come out for the everyday person, when you looked 10 years into the future, someone who ended up being diagnosed with HIV, they only had 2 to 3 years to live with so many symptoms that they would experience all the way through that reduce their comfort and quality of life. And fast forward, because of research, because of those who have been willing to participate in research, you're looking at so many years ahead, as of in 2022, more medications that have come out, or more understanding of the communities that are most impacted. And because of research, we have decreased the amount of folks who are impacted by HIV by 76%. And what that means to the everyday person is that they don't have to be concerned with their quality of life of changing. And also because of those medications that are available, it means that they no longer have to live in fear or potential stigma, because HIV carries a great deal of stigma as well. So, a personal story that I know from a colleague and a friend that I didn't expect, because they have, a PhD and they've gone through and advocated so much for HIV prevention and research. They shared that, oral medications that were available to them, it was exhausting. Research isn't always perfect. And I say that to say, like, it's not always right for everyone, whatever gets rolled out or is designed. And so because of iterations on interventions that have come out, this person was able to get, instead of taking their medication orally, they were able to get a shot.
Right.
And with that shot, they said, I didn't know if I could continue to take my medication, and I didn't know, how that was going to impact me, mental health wise. So you're giving people the option to live life in the best way that they see fit for them. And it's impacting people that you maybe wouldn't even think about, who maybe should be okay, or you would think would be okay, that are still struggling. But coming up with some of these other solutions helps the other everyday person live the best life in the context in which they see for themselves.
Yeah, and I guess this is sort of a good time for me to acknowledge, I'm a person living with HIV. I've been living with it since 2008. I get to take one pill once a day and go to the doctor a couple times a year just to make sure everything's cool. But, it really, because of science, because of research, I get the luxury of not having to think about it that much. Mm-hmm. I put that pill in my mouth once, in the morning, and that's pretty much it. Mm-hmm. A couple extra visits to the doctor. And, you were mentioning the long-acting injectables that we have as an option now too, where people could be doing this, 2 to 6 times a year, mm-hmm. Just to get one shot rather than have to even think about a pill. Mm-hmm. And I think that's sort of a good larger point, is we've reached this place in our society and in our conversation and advances in science where we have the luxury of discounting science, mm-hmm. Where we mm-hmm. now are so far advanced that people are questioning it because they don't even realize how impacted they are by it. Because I think my opinion is, and you can tell me what you think,
sure.
is all of us are alive because of science in some way.
Yeah.
The average lifespan people used to die in their 30s.
Yeah.
And now we're living much longer than that. And, diseases and illnesses that used to kill people like measles and HIV, are mm-hmm. very easy to deal with. So, yeah, tell me about that. What do you think of? Do you agree with that?
I mean, I absolutely agree with that. I honestly don't have more to add. Like, I think that we are in a position where we have the opportunity to question and discount science, but I also think like it highlights that there is an interest still in science. So spaces like, for example, the community advisory board that I mentioned. Like, we welcome folks to come and have conversations as it relates to their questioning of the science of HIV.
So, with everything that's going on in our country right now, we're seeing the director of the Health and Human Services Department cutting funding from, CDC, NIH, cutting research dollars, laying tens of thousands of people off that are doing work in areas like HIV. I know the HIV prevention services were cut this week.
Yeah.
What is the impact of that?
One of the impacts that I just learned about earlier this week, especially as someone who's an aspiring, physician going off to school this summer, is there's a program called the RAMP program that the HIV Vaccine Trials Network supports. And that program is to support the next generation of researchers to come and think about how to meet people where they are.
Well, and I think, when you talk about those numbers and we start to think about, beyond the numbers, these are people that we all know. These are not just queer people. This is not just Black and brown people. This is everyone. Because, some of the fastest growing demographics of people acquiring HIV are not the communities that we have sort of historically, recognized, because the queer community knows how to take care of it. We know we've been trained to, see our doctor, get our STI testing. We know what PrEP is. We know what PEP is. We take our medications. So, in a lot of ways, we are, even though they're trying to target us, we are less the target. This is going to have an unintended impact on other communities.
And I know I've been like throwing out so many numbers because you're shaping the what's going on just really well, but you're right. Like, now we're seeing increased cases in individuals who are heterosexual, who are having, men and women who are having sex as it relates to HIV and STI testing, but STI testing from heterosexual relationships. But then even broader, when we talk about the research context, I do think it's easy to think about groups that we think are over here, right? I talked about underserved, marginalized groups, but ultimately, like, we are connection. We are connected to what happens when someone's not able to get the services they need, or to experience interventions that are right for them, which is what happens through research. And so oftentimes we think that maybe you're like looking under a microscope, and as you're looking under a microscope, like, that's all research is, but it's also the work to understand how to get these interventions into these communities that are impacted, that aren't just of LGBTQ or Black or Latin or otherwise. So
yeah, and it really is everyone. HIV doesn't discriminate. I mean, illness doesn't discriminate, period. It sometimes disproportionately impacts communities that don't have access to services, or, where medical education isn't as good. But, we are all equally vulnerable when it comes down to it. And, it's sad to me that we have this sort of empathy deficit where we as sort of a nation, as a people, have stopped caring about things that don't impact us directly.
Right.
So, as you sort of consider the start of your career as a researcher, as a physician, what are you worried about? How are you feeling?
As I look to start my journey, I want to lean into the idea that there is this empathy deficit. I think that we are being inundated right now with a lot of places in which we can focus our lives, and a lot of political messaging has been geared towards, something negative is going to happen to you, something negative is going to happen to you. And so it's really it's I think really easy for folks to look inward, but as we think about trying to take care of each other and population health, one of the things that's going to be important to me as I go along my journey is remembering that we want to think about being hand in hand, and we want to think about community. And so one of the things that I certainly want to do as I go along my doctoring and learning journey is to think about, amazing organizations that are spaces that hold folks together, like Peer Seattle, like ARTH, African American Reach and Teach Ministries, like Entre Hermanos, where there are spaces that we can find safety in, we can have conversations, and we have to continue to make those spaces, because the more we get siloed with this work, it's easier to see someone as other. It's harder to see why someone may be harmed, or why we should care about someone else. And I feel encouraged to go bridging across spaces that maybe I don't typically spend space in, so that I can keep my heart open, my mind open to thinking about the needs of all. Because as you stated, for example, HIV impacts and can impact anyone.
Yeah, and it's strange to me. I have this conversation a lot with people in my community, that people have kind of forgotten that HIV exists. We growing up, I know I grew up watching the videos of like the AIDS quilt, and seeing those images of people dying in the hospital, emaciated, and lesions on their skin. And that's, I think, a lot of us, those images are burned into our retina. We remember them, they're indelible. But now that we don't see them, it's very much out of sight, out of mind. And so, when we read, HIV prevention funding has been cut, I connect with that viscerally. But I wonder, how do we get people to connect to that when they don't have the images sort of assaulting them every day?
I've seen a shift in folks going actually to like places like TikTok and sharing their diagnosis stories and connecting with others. And maybe they're not showing the lesions, or they're not showing themselves hospitalized, but they are sharing some of the basic symptoms that they may have experienced, like being really tired, or having some of the common things is like having like some sort of yeast infection or something to that nature. And they're getting the word out to their networks, which is where if we can just kind of chain together, right? All of a sudden you can do something at scale. I think that's how the messaging right now is looking. With some of the organizations I spoke about, or being a part of this community board work that I've done, it's going where the people are having fun. Like sometimes you got to go out to the bars. Sometimes, it's going out to the festivals to just see how people are living life, and just reminding folks like, hey, this is something that is absolutely treatable. You can live a full life. You can live a full life and not be concerned about, as long as you're taking your medication, if you are living with HIV, or even if you're not, there's medications now to, support you and staying engaged with your community. But it's not gone yet,
Yep.
right? And so we are out there, and folks are out there going to these different spaces to just provide reminders.
Yeah, we are still here.
Yeah.
So I have a couple more questions before we wrap up. I didn't ask you, what kind of medicine are you thinking of pursuing? I mean, I know you haven't even started this journey, but you must have some idea of what you like.
Yeah.
What are you thinking right now?
So right now I'm really passionate about intervening, or like breaking the cycle of family chronic diseases. And so that would lead me to family medicine.
Mm-hmm.
So I'm really passionate about thinking about like taking care of the babies all the way up to the grandparents, as a way of thinking about family units and community units, to have people see themselves in the healthiest way they can be, but like together, right? Versus just the one-off patient, like being able to talk to families that want something I'm really passionate about. So I'm excited about that.
Yeah, because we do see this sort of generational trauma which is more of a psychological concept,
Mm-hmm.
but we do see this like generational lack of education
Mm-hmm.
that, translates down with these chronic illnesses that
Mm-hmm.
are treatable, but because we're not giving people access to services and education, we just see this sort of cycle continue.
Yeah, and it might not even be it can be a lack of education, but it might be things around like different modes of thinking about accessibility, or providing something against things like misinformation as well, right? Or standing in that gap to say research has been harmful. Medications are created from the research process. Like, let's talk about how there have been, bodies and institutions and community leaders who have made sure that throughout this process, there's been checks and balances, so that if your provider, your doctor shares with you that this medication is right for you, you can have a conversation to make an informed decision as well. Because right now there's just, again, like such an influx of information out there. So
Yeah, and it's very difficult to fight against misinformation, but also, there's cultural influences that can complicate things.
Absolutely.
Where there may be a cultural distrust, but also maybe just like a cultural or religious aversion, based on norms within a culture that, we don't do these things. And it's, communication. I thank you for doing that work. It sounds amazing.
Thank you.
So I know we've talked a lot about HIV, but I think like what you started to get at is really important, which is, research is not just about these like politicized chronic illnesses that we all know about. It really is about everything. It's diabetes, it's TB, it's measles, it's, COVID, these things all, advances in these areas all stem from research. So thank you for that. I guess my final question before we close up is, if people want to do something, what should they be doing? Because right now this feels very, David and Goliath. We've got the federal government, canceling things. It's so far away. This all feels very much bigger than us. But there are things that people can do, and if someone was going to ask you, like, what could I do to make a difference? What would that be?
That is a big question in a time where I mean, we have a marathon to go. It feels like, right? This is January 20th. We started to see these changes, and we are at April the 4th.
Yeah, it's been just
2.5
over 2 months.
months. 2 months?
Yeah,
Not
just
even.
over 2 months.
You know, I think we all have scope of influence. I think there are folks who they're aware that they can reach out to their local legislators or senators. There's emails that I'm seeing all the time from distribution lists that you can get plugged into for whatever topic that moves you, especially in the space of HIV, and you can get on those distribution lists and, you know, sign up to make sure that your voice is heard whenever discussions are happening around trying to push back against these funding cuts, right? There are folks who there are opportunities to be boots on the ground and go again to some of these community center hubs that are organizing for us. I mentioned, you know, places like Arth and Pier Seattle and so. But some of the other spaces is like talk to your friends, keep the conversations open, talk to your healthcare providers. You can reach out to institutions and spaces and say, like, what's up? I'd like to hear more. I'd like to hear, you know, a place like Fred Hutch Cancer Center or the University of Washington that does a lot of amazing work. The Center for AIDS Research, who does a lot of amazing work. And go to their web pages and just info at, right? And just say, I want to hear more about this. I want to attend a webinar. I want to attend an event, or I want you to know that I want you to stand up against this, because the more folks that make noise, I think it's going to encourage us to make sure these conversations stay relevant as these news cycles keep spinning and spinning. And so I say all that to say, just keep saying something, right? Like if you're feeling something, tell somebody else about it, so that we can keep it top of mind and start thinking about ways to push to keep the great things that we have in place right now in place, because it's only going to be harder to replace it. It only gets more expensive to try to bring some of these resources back. And so that's what we can do.
Yeah, no, I couldn't agree more. You know, get loud, have the conversations, you know, don't be silent, because if it fades into the background, you know, it's never going to make any progress. So, well, Tasia, thank you so much for sharing this conversation with me today and sharing your passions and just everything about you. I'm even more grateful to know you after this time together.
Thank you so much. Thank you.
Well, thank you all for listening, watching, tuning in to King County Recovery Conversations. Thanks again to King County Recovery Coalition, King County Behavioral Health and Recovery Division, and Orbit Audio for hosting us here. And of course, congratulations, Tasia, on getting into school. Go change the world.
Thank you.
Thanks.